Today, we are going to talk about joint replacement. Orthopedics is the branch of medicine that specializes in the correction of deformities in bone and muscles. This includes joint replacement with a prosthesis, megaprosthesis, and revision surgery. Total joint replacement is a surgical procedure in which parts of an arthritic or damaged joint are removed and replaced with a metal, plastic, or ceramic device called a prosthesis. The prosthesis is designed to replicate the movement of a normal, healthy joint. A megaprosthesis is used to reconstruct bones as well as joints affected by disease. They are typically used to replace an entire limb, such as the femur, tibia, and humerus. Revision surgery. In this procedure, the orthopedic surgeon removes some or all of the parts of the original prosthesis and replaces them with new ones. Revision surgeries are required if the existing artificial joint becomes infected, worn out, loosened, or associated with bone fracture. They are also needed when the original artificial joint service lifetime expires or is recalled. Although both procedures have the same goal to relieve pain and improve function, revision surgery is generally different than the primary placement. Joint replacement surgeries are most commonly performed on the hip, knee, and shoulder joints. They are less common on the elbow, wrist, and ankle joints. Joint replacements are recommended when osteoarthritis or rheumatoid arthritis is painful enough to affect quality of life or impairs the ability to work or undertake activities of a normal life. They are advised when less invasive forms of treatment, like physiotherapy, are no longer sufficient. Joint replacement surgery is also used to restore normal function after severe trauma or when comorbid conditions like obesity require it. Joint replacement surgery involves removal of damaged cartilage and bone from the affected joint. These structures are replaced with the artificial joint that is cemented into bone, screwed, or installed with a special coating to promote integration to the bone through growth and healing of new bone. Following joint replacement surgery, the recovery recommendations vary depending on what joint has been replaced. Generally, 3 days in hospital following surgery is normal, but that can vary following health or surgical complications. Clearance must be given by the orthopedic surgeon prior to driving. This is especially important with hip and knee replacements. It is important to take all medications as prescribed by the doctor. This includes pain medications, antibiotics, and anti-inflammatories. These medications may have side effects like nausea or constipation. It is important to resume nutritious eating and drinking lots of fluids as soon as the patient is able following surgery. This will improve healing. The skin surrounding the surgical site must be kept clean and free of infection. The doctor will advise on their preferred protocols for changing surgical dressings. Weakness is not uncommon following surgery, especially in the joint the procedure was performed. It is important to rehab the joint with exercises recommended by the doctor and the physiotherapist to regain strength, stability, and flexibility in the prosthetic joint. This is important for weight bearing, standing, walking, and sitting. Specific assistance tools will be recommended by the doctor depending on what joint is replaced. For example, knee and hip joints require the use of walkers and canes post-operatively to assist with walking and standing. Blood clots are a risk of any surgery, especially ones that lay a patient up in bed. It is important to get up and moving as soon as the patient is able. Circulation exercises reduce the risk of developing blood clots and will be provided by the surgeon. Follow-up appointments will be scheduled as recommended by the operating surgeon to monitor health and healing. Bacteremia is the presence of bacteria in the blood that is the leading cause of local or superficial infection spread to the body's internal organs and structures. It can result from simple cuts and scratches or occur after oral healthcare procedures, surgery, or other invasive procedures. Generally, it evokes a strong immune response, but in a compromised immune system can be dangerous. Hematogenous seeding of artificial joints is when bacteremia pass into artificial joints. This can result in infection. Although a rare complication, Joint replacement infection is a devastating problem that could ultimately lead to the need for revision surgery. This is because bacteria are difficult to eliminate from the implant joint. Infection may not be adequately countered by the body's immune system because of alteration of the immune system's normal function of defending tissues against bacteria due to the material implanted at the joint. Infection occurs in 0.3 to 1% of hip replacement patients and in 1 to 2% in knee replacement patients. Infections can occur as early infections or late infections. Early infections occur in the days or weeks following joint replacement surgery. Late infections can occur in months or years following surgery. They are often difficult to treat and require comprehensive antibiotic treatment or revision surgery. Hematogenous seeding is responsible in 35 to 40% of joint replacement infections, predominantly caused by skin infections and urinary tract infections. Dental treatments cannot be excluded as the cause of a small percentage of hematogenous infections. Signs and symptoms of joint replacement infections include chills, drainage of the incision site, increasing redness, tenderness, and swelling of the surgical site, skin that is warm to the touch in the area of the replaced joint, pain that increases with activity and rest, persistent fever, and swelling. Some pain, tenderness, and swelling is expected following a replacement surgery. However, if these symptoms worsen or do not begin to subside, immediate examination and treatment are recommended. Early infections can be prevented with the use of antibiotics prior to joint replacement surgery and continued for a short time post-op. It is also important that sterile protocols are followed at the time of surgery to prevent early infections. Optimal oral health achieved prior to replacement surgery can also help prevent early infections. This includes regular dental hygiene care and restorative dental procedures. The use of antibiotic prophylaxis does not necessarily prevent late infections. However, is sometimes prescribed prior to dental procedures for this reason. There has been great debate regarding the use of prophylaxis antibiotics for dental procedures following joint replacement surgery. From 1997 to 2009, the American Academy of Orthopedic Surgeons and the ADA agreed that antibiotic prophylaxis was recommended 2 years following replacement surgery. Exceptions existed that required their use for life in some patients. The CDA confirmed support of this protocol in 2007. In 2010, the American Academy of Orthopedic Surgeons released new information urging surgeons to make their own decisions when prescribing antibiotic prophylaxis. In 2012, a systemic review of previously released information from the ADA and AAOS found no direct evidence to connect dental procedures to orthopedic implant infections. In 2013, the CDA agreed that antibiotic prophylaxis was no longer indicated for clients with total joint replacements, orthopedic pins, plates, and screws. In 2014, a panel of experts agreed with the 2013 position of the CDA. In the summer of 2016, Canadian bodies released evidence-based statements that also agreed with the 2013 position of the CDA, advising antibiotic prophylaxis is not indicated following a joint replacement. In the fall of 2016, American bodies opted criteria amending prophylactic antibiotics for clients with certain comorbidities or a history of prosthetic joint infection. Dental hygiene considerations for the joint replacement client. During the assessment phase of treatment, while taking the medical history, it is important for the dental hygienist to focus on screening the client before treatment for key symptoms, medication considerations, contraindications, complications, comorbidities, and associated conditions. The RDH must evaluate the need for consultation with the primary doctor or orthopedic surgeon. In most circumstances, medical consult is not required. However, because of the varying opinions on antibiotic prophylaxis, it is important to know for certain if your client requires it as per their orthopedic surgeon. Medical consult is advised if there is suspicion of prosthetic joint infection or concern regarding the joint's function. It is also advised when one or more comorbidities exist. Invasive dental treatment should be postponed in the absence of antibiotic prophylaxis if it is required. All dental hygiene procedures should be delayed for several weeks following joint replacement or revision surgery, or unless clearance is given by the orthopedic surgeon. Some surgeons require delaying dental procedures for 6 weeks post-op, while others advise 3 to 6 months. Investigate history of infection, infected prosthetic joints, symptoms suggesting a possible joint infection, the client's comprehension and acknowledgement of the importance of oral health care, problems with infections generally, the client's current health status, and how the client's current symptoms relate to their oral health and general health, and recent changes in their condition. When looking for medical consultation and clearance, it is important for the dental hygienist to first consider the most appropriate healthcare provider to obtain consultation and clearance from. In the case of a joint replacement, it is advised that the dental hygienist contact the client's orthopedic surgeon. The name and telephone number should be obtained from the client, along with written consent to contact their doctor. A medical consultation form should be faxed to the orthopedic surgeon, including the client's written consent, a statement of the procedures proposed, requests for advice on proceeding with dental treatment, and any precautions to look out for. Comorbid conditions are conditions which may exist side by side with joint replacements, but are not considered to necessarily be the direct cause of requiring one. It is important that the dental hygienist investigate all comorbid conditions of the client and treat them accordingly. If a joint replacement client presents with one or more comorbid condition, a medical consultation and clearance is required. Information regarding all comorbid conditions can be found on the CDHO Knowledge Network. When recommended, antibiotic prophylaxis should be administered 30 to 60 minutes prior to any dental treatment. Most commonly, amoxicillin is prescribed, but this can vary if a penicillin allergy exists or based on preference of the orthopedic surgeon. Clients who are unable to take oral antibiotics can have intramuscular or intravenous options administered outside the dental office. Although there are no oral manifestations related to joint replacements, it is important for the dental hygienist to investigate the oral health implications of medications and comorbidities of their client. There is no contraindication to proceed with treatment in a healthy client so long as their pre-medication requirement is satisfied if required. Treatment may be postponed if the dental hygienist is awaiting medical clearance or consultation, in the absence of prophylaxis, if medications have recently changed, or if there has been a recent change in medical condition. The dental hygienist should encourage the client to disclose that they have had a history of joint replacement and the medications they are taking. It is the responsibility of the client who has had the joint replacement surgery to take the necessary steps to prevent infection after surgery. It is then the responsibility of the dental hygienist to proceed with care accordingly. The dental hygienist should discuss, when appropriate, the importance of regular professional, dental, and oral self-care to prevent oral disease and infection, as well as specific dental interventions to suit the client needs. Comfort during dental treatment should also be a priority for the dental hygienist. Clients awaiting or who have had recent joint replacement surgery may find some chair positions uncomfortable. Appointments should be scheduled to minimize stress and discomfort. Promoting oral health through oral hygiene treatment is a great benefit of implementation. A healthy mouth has a reduced risk of hematogenous seeding of bacteria onto prosthetic joints resulting from invasive dental procedures. Maintenance minimizes the risk of unmet human needs that draw clients away from optimal oral and overall health. Potential harms of implementation include causing hematogenous seeding resulting from invasive dental procedures, performing procedures too close prior to or following replacement surgery, scheduling appointments without knowledge or recommended antibiotic prophylaxis, interrupting normal dietary and medication practices, and incorrect management of pain or medications. However, if the dental hygienist follows advised procedure and medical consultation and clearance, the risk of harm is very low. Client history is important during all phases of the process of care. The joint replacement client may not have any oral manifestations associated with the replacement itself, but it is important for the dental hygienist to evaluate how comorbidities affect the oral cavity when they apply. In cases with clients with one or more comorbidity, medical consult and clearance is required. It is also important to be aware of the signs associated with prosthetic joint infection on an ongoing basis, should a client develop a late infection. Good oral health and hygiene status promote good overall health. It prevents disease in the mouth, decreases oral bacteremia, and should always be advocated to clients with a history of joint replacement and those requiring joint replacement in the future.